Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I've got my co-host JP with me. How are you?
I'm doing really well. Looking forward to leaning in about the thyroid today.
Yes, absolutely. And we are joined by a wonderful guest, Dr. Amie Hornamen. How are you?
I am so good. I'm so happy to be here. Thanks for having me.
We're really excited about your upcoming book. I haven't had a chance to dig into it personally yet, but when it does come through, I will definitely be parsing through and making sure that I understand everything that you're talking about. But lucky me, I get to have this wonderful conversation with you just prior to the book release. So excited to do that with you. Before we dig into how do we fix the thyroid, I want to first ask you what brought you into this world and what was it from a thyroid specific perspective that prompted you to want to learn and share about this topic?
Absolutely. Well, thank you for asking. I think so many of us in this entire health space are here because of a really common thread called pain. And my story is no different. It's a pain to purpose story in that when I rewind about 25, 30 years ago, back in my younger days, I was a really good athlete and I was competing at a high level in the bodybuilding, fitness, and figure world. I was doing fitness modeling, I was doing all of these different shows, and I knew exactly how my body was supposed to respond. I had done plenty of them. So I knew, okay, this is the diet. This is the workout regimen. I had my coach telling me what to do, had check-ins with him. And I knew, okay, by week 8, I'm going to be at this weight. And then by week 12, I'm going to be almost ready to step on the stage. Like it just flowed. So I'm getting ready for this really big show. And I keep getting on the scale. I have to send my weight, my weekly picks to my coach. And every time I'm getting on the scale, it's going up. And it's like going up by like 5 pounds at a time. So at first I'm like, all right, wait a minute. Maybe I'm just eating too much salt. Maybe I need to drink more water. Maybe I need to restrict more. Maybe I need to exercise more. So I take on the blame in the beginning. Then it goes up 10 pounds. And I'm like, yeah, this isn't right. My coach thinks I'm cheating. So I start wearing, sweatshirts. I'm hiding my body at the gym. Because then you can hear the whispers at the gym. Like, oh yeah, she's eating the donuts. She caved, right? She's not sticking to her diet. But I was doing all the things and then some. Scale goes up again and again and again. Well, by that time, I had to drop out of the show. There was no way I was going to be ready. I'm disappointed in myself. My coach doesn't know what's going on. I'm like, well, I'm going to go to the doctor, right? Because that's what we do. So I go to my doctor, start with my PCP. And I'm like, hey, doc, what's going on? By now, the scale is up like 25, 30 pounds in a very short amount of time. I'm losing my hair. I'm fatigued. I'm in my 20s and I don't have energy to get through the day. And he looks at me and goes, oh, well, you're normal. Everything is fine. Now, to this day, I would love to go back and see what lab markers he drew, right? I mean, we can all guess. We can all guess that they were limited. But he looks at me and tells me I'm fine. So I leave there. Like, no, I don't feel fine. I'm not going to accept that. So I keep going. I keep pursuing. So I go to doctor number 2, 3, 4, 5, and 6, who all misdiagnosed me. They all medically gaslit me. They told me I was fine, normal, just eat less and exercise more, one of them said. Meanwhile, I am bringing in my diet. It is chicken, broccoli, asparagus, fish. I'm going to the gym twice a day, not once, twice a day. And the scale is going up. That doesn't even make sense. Biologically, that doesn't even make sense. I knew something had to be wrong. Something had to be wrong with my body. Finally, doctor number 7 touches my throat and says, swallow. And she says, I'm feeling some nodules on your thyroid. Your labs look like you do have hypothyroidism. Here's a pill. Well, I left that office pumped up. Like, yes, finally, I have a diagnosis. And now I have a pill that's going to fix me. This is amazing. And quite frankly, Dr. Habib, I would have taken any diagnosis at that point. I hate saying that out loud. Like, I don't want to put out bad juju into the universe, but I would have taken any diagnosis because it would have at least been an explanation as to why my body was giving me the middle finger, basically, at that time. So,
well, you were looking for validation.
Yes.
You knew something was wrong and all these people were telling you there's nothing wrong. And finally get somebody saying, no, you're right, there is something wrong, and you're happy about it.
Best day ever. Best day ever, right? Until 5 months later, when I have not lost any weight, nor do I feel any better. So I start doing some Dr. Googling. And Dr. Google at the time tells me about this little pill that I have. And turns out, oh, it's T4. And T4 is the inactive thyroid hormone. And there's this other medication called T3. That's the active thyroid hormone. And sometimes we put both of them together. Well, that made sense to me, right? Why not skip the middleman and just give the body what it actually wants? So I go back to my doctor and I tell her about this finding that I found on Dr. Google. And she says, that's not standard of care. I don't do that. So I said, I'm going to find someone who does. And that's what led me into functional medicine. So my functional medicine practitioner that I finally saw, I always laugh. I said, he spent 83 more minutes with me than any other doctor that I saw. Meaning like, yeah, I got the 5 to 7 minute visit with all the others, but he actually spent time and cared. And we had this book of testing that we went through, that he went through with me to help me understand exactly what was going on with my body. Help me understand that I had a conversion problem that I know we're going to talk about today, and put me on the right thyroid hormone replacement that actually allowed me to lose the weight, regrow my hair, get my energy back, essentially get my life back. So that's when I changed careers.
It's your pain to purpose story is so validating for a lot of people that are out there that are still in pain. And I think my goal as a practitioner, as a clinician, is to empower people to say, you know what? If we are able to spend a little bit more time and actually dig deeper, nobody has to live in your body except for you. Nobody knows your body as well as you do. And I think that is how people can be empowered to say, if you truly feel like something is wrong, find a practitioner that's going to help you validate the real reasons why this is happening and explain it to you and work with you to figure out the single best solution that's available. So,
and if you have a clinician out there whose fundamental position relative to you is believing that you're lying to them, get away from that physician. If there's somebody out there that you're talking to who you're giving them the truth, and why would you lie about something like this? And they're saying, you're just eating too much, you're not exercising enough, or, I'm not going to do something that you may believe is right for you because I don't want to spend the time to figure it out. That's not somebody. Doctor is derived from the Latin word for to teach.
docere,
Okay.
yeah.
It's not to, subjugate and to dominate over. I mean, you're supposed to learn.
Yeah.
Yes,
Absolutely.
absolutely.
Functional medicine was big for me in my journey as well, as I, as a chiropractor, was spending a little bit more than 5 minutes with each patient. But it was this idea of how do we optimize the function of the body, not just simply find a diagnosis and treat an ill with a pill, right? And we didn't want to do that anymore. Now, there may be a situation where a pill is required, such as yours. And that's where the benefits can be effective and long-term. And so let's talk a little bit about the functional medicine approach that helped you identify what these issues were and how you now include these practices, these tests into your care protocols in the Thyroid Fix.
Yeah. So great question. My approach is not at all anti-medication. In fact, I put thyroid hormone replacement, thyroid medication, I put that in the hormone replacement category because it's almost like we can't think of it as medication. The medications are the Band-Aids that conventional medicine hands out like candy. Oh, you're depressed, Susie? Here's an antidepressant. Here's a statin. Here's a sleeping pill. Here's a blood pressure medication, without looking at the root cause. Because truly, functional medicine is about looking at the root cause of what's going on with you. Sometimes, however, thyroid is the root cause. Okay, yes, we can go deeper and say, well, what caused the thyroid problem? Was it that you had Epstein-Barr virus? Yeah, okay, well, we all do. Was it that you went through a major stressor? Did you over-exercise and undereat like I did? And that flipped that switch on for Hashimoto's? Or were you pregnant? Something as simple as pregnancy is a huge contributor to the onset of hypothyroidism or Hashimoto's. So sometimes we don't need to look beyond the thyroid. We just go, okay, the thyroid is the root cause. That's the problem. And then let's address that. Now, the approach we take is it's not all woo, I want to say. It's not all like, oh, let's sprinkle some adrenal fairy dust and put you on this diet and these 10 supplements and your thyroid will magically remedy itself. No, that's not the case. Sometimes it is using the thyroid hormone replacement therapy to really move the needle and to get you well. I mean, in my case, you're going to have to pry my T3 out of my dead cold hands before I let it go, along with my estrogen and my progesterone and my testosterone and my LDN. So in certain cases, writing that prescription on the prescription pad, whether it goes to Walgreens or a compounding pharmacy, can really change your life. But it's not about writing the prescriptions for the Band-Aids. It's about finding the root.
Yeah, it's not about using one size fits all. If everybody's walking around with a hammer, everything looks like a nail. But there's underlying mechanisms that are different in one person versus another. Even though their symptoms may be similar or their complaints may be similar, it's very different. And for example, we've got people out there who are gaining weight inexplicably the way you were in that situation. But then you've got people who are gaining weight because they've got a sugar addiction or because they're not exercising properly. There's a lot more stress in their lives, so they have cortisol problems. I mean, so there's lots of different reasons why a person may show up in the office with one symptom, but that doesn't mean that one medication is going to fit everybody. So, we'll get into some of the ways in which medications actually affect the thyroid, but it's really important to get to somebody who will spend the time to figure you out, not figure out what some clinical study that had 10,000 people that aren't you said.
Right. Exactly. And to your point too, there are many times where we'll see, I always call them like the pop-up telehealth clinics now, that they're just like popping up on every corner, claiming to be able to fix your hormones and all that. And they'll hand out thyroid medication like candy. So if someone comes in, oh, I can't lose weight. Oh, here's T3. No. That's the other end. That's the other extreme, that we don't want you taking thyroid medication if you truly don't need it. So to your point, is your weight gain thyroid related? Or is it because you treat your body like a dumpster fire? Like, we don't know. We have to unpack that. Or is it cortisol? Or is it your low testosterone? Let's test and look at the totality of your symptoms. And then let's overlay that with your labs and look at you as that whole person going, okay, here's all the data we have. And it turns out that, yes, you have like 5 or 6 symptoms that tie to thyroid disruption. And then we move over here and we go, oh, yeah, you do have Hashimoto antibodies, your free T3 is low. In that case, yes, let's use the thyroid hormone replacement. But I did want to throw that in because the other end of the spectrum, when you're not getting help in conventional medicine, also don't go to the pop-up telehealth clinic and just get handed T3 like candy, because that can do damage.
For sure.
Have you identified, and I'm actually really curious about this, have you identified any particular patterns that patients that have thyroid-based issues like a hypothyroidism or Hashimoto's, that these patients experience, or they've had experiences of some sort of stress or trauma? Have you identified any sort of patterns on their stress management types, anything along those lines?
That's a great question. It's hard because it's like, which came first, right? So when we see patients coming to our clinic, they've already run the gamut. They've been to at least 2 or 3 conventional doctors, maybe 1 or 2 functional practitioners that just didn't specialize in the thyroid. They did a gut healing protocol with them and that's it. And so by the time they come to us, it's like there's such a layer of anxiety, of brain fog. Their thyroid's low and that's producing anxiety, but they're also anxious because they're starting to get frustrated now. They're starting to wonder if anybody actually can help them. Does anyone really have the answers? I don't know. So it's hard to say if they're coming to us stressed and that's a pattern in their life, and then that stress and that high cortisol affected the thyroid or affected T4 to T3 conversion, or is it just because of what they've been through by the time they got to me?
Yeah, that makes a lot of sense. And it's obviously difficult to identify because when they come to you, they've either the stress triggered a thyroid type issue or they're stressed because they can't find good care for what they're dealing with. And it is challenging to be the fourth, fifth, sixth practitioner that somebody comes to because there's a lot of expectations that they have, or there's a lot of experiences that they've gone through that are quite negative or have clouded their judgment. And add that on to, man, I'm dealing with brain fog and I can't make a great decision, or my memory is shot and I can't remember this or that I'm dealing with because of the biological and physiological processes that are occurring. So that's a challenging thing to go through. I just wanted to see if there was some sort of pattern that you had been able to ID there. But
let me ask a question, because I think there's probably some of our audience out there who aren't really familiar. We tossed around these terms of T4 as being the inactive form and the T3 being the active form, and the iodine switching, et cetera. Why don't we spend just a minute or two to unpack what the thyroid does with respect to T4 and T3 and how it impacts the cells and the ability to metabolize various different nutrients?
Yes, absolutely. Okay, so this is going to be your 2-minute Thyroid 101 crash course. So thyroid, master gland, controls the body. I always say from head to toe, it runs the show. So we're talking about your hair, your brain, your mood, your cognition, your heart rate, your body temperature, your metabolism, your gut motility, whether or not you poop every day, the whole deal. It's run by the thyroid. The thyroid produces 4 thyroid hormones: T1, T2, T3, and T4. Now, the only ones that we're going to talk about really today are T3 and T4. T1 is inactive. T2 is really cool. That requires a whole big deep dive because that will actually increase your basal metabolic rate. It's not in medication form. It's actually in supplement form. So that one's really cool. We can always circle back to that. Let's focus on T4 and T3 because those are the two that you're going to be tested for. Those are the two that we have pharmaceuticals for. So that's what we use for thyroid hormone replacement. Now, T4 is inactive. So roughly your body makes around 80%-ish T4. We don't know that for certain, but we're guessing 80% T4 and around 20% T3. And that T4 is inactive. It literally has to become T3. So I always say T4 is like sitting at a starting gate, and it has 2 different paths it can run down. We hope that it goes this way and runs down the free T3 path and literally becomes that active thyroid hormone T3. T3 is the only thyroid hormone that can get to your cell and attach at the cell level. So think about like a lock and key. T3 comes in and it sees that perfect keyhole opening, and it attaches and it turns it. And that's what's lighting up your brain and giving you a metabolism, doing all the things in your body. But it has another path it can go down instead. We hope it doesn't go down that path, but it does in many situations. Reverse T3. So T4 can also become something called reverse T3. Reverse T3 is your anti-thyroid hormone, essentially. I like using analogies so people understand. So the analogy I use for reverse T3 is like a bouncer at a club. So when we start building up your bouncers, right? And the bouncers sit outside your cell doors, arms crossed like the big guys do at the clubs. And they're looking at T3 going, yeah, you're not coming in today. Yeah, no, you're not coming in today either. And it's literally blocking T3 from getting to the club, from getting to your cell to do its job. Reverse T3 is fantastic if we're lying and dying in the ICU or the ER and we're fighting for our life. Because thank God it was built into our body to say, hey, you know what? When you're fighting for your life, you don't need to burn fat, make major decisions, or poop every day. You just need to lie there and survive. But the problem is if reverse T3 is high when you're not lying there, when you're walking around trying to live life. So that's why we want to know it. We want to test it every single time. And we want to address it if it's high. Look for the factors that are pushing it high. And sometimes that factor can be lifestyle. It could be genetics. It could be elevated insulin, which 93% of all Americans have insulin resistance. So that's a big factor. It could be nutrient depletion. Low mag, low D, low iodine, low selenium, low zinc. Or it could just be that you are put on way too much T4 by your doctor because we know that standard of care. Oh, here's 50 micrograms of Synthroid, Sally. Oh, you're not feeling better. Let's go to 88. Oh, okay. We're going to go to 112. Oh, maybe 150. And Sally never feels any better because all of that T4 is being pushed to reverse T3, literally putting her body into a hibernation survival mode situation.
100%. That's a great tutorial. Appreciate that very much for our audience.
Yeah, you hit the nail on the head with that for sure.
So if you are confronted with a person who has all of these symptoms, there are, again, multiple ways that they could be reaching those symptoms. What are the tests that they should be going through? And how do you differentiate? As you said, when you go to a standard, US trained doctor, they're going to do a panel of blood work. They're going to look at it and they're going to put you on Synthroid, or they're going to put you on T4. How do you differentiate between whether or not T4 is what you need or T3 is what you need?
Yeah, that's a great question. Fantastic question. It really is about looking at the full picture. So first, test. Test, don't guess. So we want to test thoroughly. So when you go, just like you were saying, JP, when you go to your conventional doc, you're going to get TSH, maybe a free T4, maybe. You're not going to get free T3, reverse T3, and the TPO and the TGA antibodies that test for Hashimoto's. You're just not, unless you ask for it, and even if you ask for it, you can still get told no. You have to test thoroughly. Now, my rule of thumb is even if you go in, you're listening to this right now, you're writing down, okay, TSH, free T4, free T3, reverse T3, TPO and TGA antibodies, replay that and write those down. And you go in with that list to your doctor. My rule is if your doctor says no to testing, it's time to get a new doctor. Because it's no skin off their back to write those on a pad. And listen, if your insurance isn't going to cover it, because a lot of them say, well, your insurance isn't going to cover this, then you know what? That's my decision. Then you tell me that, and that's my decision still to pay out of pocket for that particular test, to order it myself through LabCorp, through Ulta Labs, any lab test now, all the variety of different places we can go now to order our own labs. That should be my decision, not yours. But if a doctor says no to testing, it's time to get a new doctor, because there's no way they're going to be able to treat you if they don't even test. So get that testing done first. Then that way we at least know where your numbers are. Now, when you have those numbers back, now we have to look at them through an optimal lens. So if I'm sitting there with a patient, I'm going to listen to them. Number one, I'm going to ask them the four most important words that any practitioner can ever ask. And if you don't hear these words, I know there's a lot of laws and rules that I'm throwing out there, but they'll help you, I promise. If you do not hear these four words from your practitioner, your doctor, your PA, your NP, whoever you're working with, then you got to turn and leave. Okay, here they are. Write them down. How do you feel? Because if you're not asked that, then you're being treated as a lab value. So we need to look at how you're feeling. We need to look at your labs and put those over each other. And then we go, okay, Sally, you're on T4 only right now from your PCP. And you're on a pretty hefty dose, which explains why over here, your reverse T3 is a 22. So what we're going to do is I don't want to take you from, like 150 micrograms of T4 down to 0. So we're going to we're going to back down on that T4. We're going to add in some T3, because by the way, your free T3 is low too. We're going to add in some T3, and at the same time, we are going to work on any factor that looks like it could be driving up your reverse T3. Whether it's, okay, no, you're not taking iodine. Well, low iodine is one of the biggest reasons for elevated reverse T3. Oh, you're stressed out, like you mentioned earlier. Oh, yeah, you're stressed out. Okay, we got to address the adrenals over here. Maybe we do have to address your gut if you have dysbiosis. We do it at the same time. What drives me bananas, and I'll just throw this in since I just mentioned the gut and the adrenals, what drives me bananas are people that are like, okay, we're not going to address your thyroid right now. We're just going to put you on a gut healing program. I'm like, have you ever had hypothyroidism? Do you know that you want to get better yesterday? And I ain't got time for a 6-month gut healing program. Why don't we just do them both at the same time so we can get that person better, quicker, and they can get back their quality of life, because that's really what they're in it for. They just want their life back. So yeah, we have to look at everything and do everything at the same time.
That's a really good point. And you mentioned a couple of the tests there. I just want to point to people and get your take on this. TSH is not a thyroid hormone. It is a pituitary hormone called thyroid stimulating hormone. When you test TSH, you are not testing the thyroid. And I think practitioners out there need to know that. Thyroid stimulating hormone is not a thyroid hormone. So If you're just testing TSH and barely getting a free T4, you're not getting proper thyroid testing, period. Now, pituitary tells the pituitary gland that is just below your brain, kind of dangling off, sends out thyroid stimulating hormone into the bloodstream, which goes to the thyroid where T4 is created, majority, and a minority of T3 is created. But you talked about the conversion of T4 to T3, and that does not happen in the thyroid. Let's talk about where that happens and what's important for factors of your overall health to enable T4 to T3 to properly occur.
Absolutely. So I would say that conversion is like running 10 Tough Mudders. I mean, especially in this day and age, it's really hard for your body to do. In conventional medicine, they assume that, oh yeah, the body just converts. That's what it does. It's easy breezy. Just give a person T4 and it'll convert. But when you really look beneath the surface at all of those conversion factors, you go, really? Can a person easily do this? Okay. Number one, we already mentioned it, insulin resistance. 93% of Americans have insulin resistance. I mean, we are living in a toxic soup environment. We have more processed foods than ever. Our soil is more depleted than ever. This is not the same world as 40 years ago when T4 only monotherapy was standard of care and it worked for everybody. Okay. That we are in a totally different environment. Our body is being pounded by things that just weren't there 50 years ago. The stressors alone, I mean, social media, come on. So all of that. So elevated cortisol, elevated insulin, estrogen dominance. What about the amount of xenoestrogens that we are exposed to that abnormally raise our estrogen levels or put us into a state of estrogen dominance or progesterone deficiency? That can increase reverse T3. We had already mentioned low iodine, low selenium, low zinc, low magnesium, low vitamin D, all of those cofactors that are key for that T4 to T3 conversion to occur. There are genetic SNPs. So there are actual enzymes called deiodinase enzymes that are released from your gut and your liver that help to convert T4 to T3. Well, people can have SNPs, SNPs, on certain genes that hinder enzyme production. So when we see that, and I'm actually one of those people, when we see that, those individuals might need a lot less T4 and way more T3 to dominate, or they might even be T3 only. I am T3 only. I do not convert at all. If you give me any amount of T4, I will be 10 pounds heavier in a week and clinically depressed. So I know because I've experimented on myself. So yeah, those conversion locations, the gut, the liver. I mean, okay, let's talk liver now. Over 500 metabolic functions of our liver. And we're living in a day and age where alcohol is just socially acceptable every single day. You have a headache, go ahead and pop a Tylenol or an Advil. And that's not even counting all of the medications that people are on. And even the supplements, even the good supplements that we take still have to be processed through the liver. So our liver is taking a pounding, and that's another conversion location of T4 to T3.
I don't 100%. Know anybody who has gut or liver issues. Like that's not common at all, is it? It's really crazy to think that we've talked thyroid for so long in general medicine that thyroid is about the thyroid, and it's really not. It really does come down to a holistic view of every organ working well, particularly microbiome, gut, and liver function. And like you mentioned, those deiodinase enzymes are produced in the gut and in the liver. And when the T4 gets there, it's going to take off one iodine going from T4 to T3. Then we have, ideally, T3, unless we go down that reverse T3 pathway, which would suck. So thyroid health is holistic health. I think that is a huge point that people need to understand is we need to look at the gut, we need to look at the liver. But I love what you're saying here is let's get you feeling better at the same time as getting the organs working better so that you can maintain long-term, but you're already feeling better to be able to do that. I'm actually really intrigued by this because that's not a common thought process in functional medicine, unfortunately.
Let me ask you a question because I'm probably the one who advocates on the podcast slightly more for intermittent fasting and forms of fasting that help to remove the stressors of food, remove the stressors of trying to process through all the things that come along with food, which aren't food, toxins and processing agents and other things that do tax the liver. As we know, anything that you ingest is going to leave your gut, go up to your liver, have to be processed, with the cytochrome 450 cascade, et cetera. And you're constantly taxing your liver if you are constantly eating. You're constantly taxing your gut if you don't eat. You're constantly taxing your metabolism throughout every cell in your body. You need to spend time in, I don't want to call it calorie deficit, but in just stopping the flow of nutrients so that your body can cleanse itself. I would assume that that's a very positive thing for the thyroid. So, but the body has interesting ways of responding to things. So would you in general say that if a person is having difficulty getting that T4 to T3 conversion, but they don't have the SNP that you have, and they're in a position where it's probably being bogged down by the fact that their liver isn't producing enough, their gut isn't producing enough, that spending a little time intermittent fasting and keeping the food intake very whole food, very pure, not processed, and maybe, even low inflammation foods, that those are good steps to revitalizing and resuscitating their natural T4 to T3 conversion, which, as you said, 50 years ago, everybody seemed to have it and now we don't.
Right. So fasting, it really depends on the person. I'm a huge fan of it, just not taken to extremes, especially in women, because women are notorious for not eating enough protein anyways. And then when a woman decides, oh, you know what, I'm going to do a fast to try to improve my health, and usually it's to lose weight, she'll push it. She'll push it to the 20 hours, to the 18 hours. And then in her eating window, she's nowhere near able to get, let's say, 100 to 130 grams of protein. It's just not going to happen. So I really want her to get the protein to protect her muscles. I also don't want too much stress on the system. So if someone already has an elevated reverse T3, and we know that cortisol can push that up as well, I don't want to stress her body more with extended fasts. Let's keep that at maybe a 14, maybe a 16-hour fast. That's nice. And that's enough to get that autophagy, get the benefits of the fasting. Like you said, give the liver a break, give your pancreas a break, give your digestion a break. And then you have that 8-hour eating window, which 8 hours is more than enough to get in adequate amounts of protein. And, you're not, of course, feeding your face all day throughout that 8 hours. Maybe it is 3 meals, maybe 3 meals and 1 snack in that 8-hour window. But that's really giving you the best of both worlds without going to the extremes.
Yeah, I think that makes a lot of sense. And I can imagine in a situation where a patient comes in and they're not doing so hot, right? Like they're in a lot of pain or they're not mentally capable of taking it on. I feel like if they are able to start doing a fast or taking some reduction in the frequency of eating, it'll actually make a huge benefit. But it can be challenging to take on right away. So maybe more as a longer term maintenance strategy, it can be implemented a little bit more. But yeah, both of you guys are on exactly the right track here, because ultimately there is a strong metabolic component that needs to be looked at here, right? We need metabolism to become more efficient, more optimized. And the liver is huge when it comes to making sure that metabolism is working. You mentioned a couple times this 93% of Americans have insulin resistance. It's the stat is astounding, right? And when we dig into what does that mean, what are some of the conditions that are clearly noticeable that are linked to this issue and tied directly to Hashimoto's / hypothyroidism overall, with the metabolic component and the thyroid component?
So with the thyroid, whether it's that primary hypothyroidism or Hashimoto's, and I'll take this time to also say 95% of all hypothyroidism, so low and slow thyroid function, most of the time it is Hashimoto's. I mean, we see very few direct primary hypothyroid cases. That's usually from maybe a history of eating disorders, like way too much under eating, over exercising, certain medications, chemotherapy, radiation. That's where we'll see non-Hashimoto's thyroiditis. But most of the time we're seeing Hashimoto's. So with that, doesn't matter whether it's primary or Hashi, the thyroid controls your metabolism. And it controls it at a cell level. So it's going to literally control how your body produces ATP, whether or not it is in a state of thermogenesis, if it's in a state of fat burning, the thyroid has a dictation over that. But indirectly, we're also seeing it affect insulin control, insulin and glucose control. So for instance, you could have someone, and I've had these patients, they are full carnivore, or they're very strict keto. They're consuming little to no carbohydrates whatsoever. And they're still looking like a type 2 diabetic with elevated insulin. And we're like, what is happening here? It's all coming from the thyroid. The thyroid is so dysregulated, not optimized. Maybe they're diagnosed, but they're not being treated properly. They're on T4 only. And that's where we'll see the thyroid have an effect on your glucose regulation. It's like you can't even balance your blood sugar because the signals coming from your thyroid to all of your cells, it's almost like the signals get crossed and they're static and the message isn't getting there. So the pancreas is like, oh, a piece of steak. Oh yeah, we got to treat this like pizza. Let's push out some insulin. And then
the liver,
your cell,
and the liver producing sugar when it shouldn't.
Bingo. Exactly. I had a patient once, and I know we're going to talk GLP, so I'll throw this story in now. I had a patient, she came in. This one always stands out to me. I actually write about it in the book too. She was on a GLP prescribed for about a year and a half. So she was full dose. She wasn't microdosing from, like a research site. This was a prescription GLP-1 for her type 2 diabetes, which her A1C was an 11.9, and she was around 150 to 200 pounds overweight. Like that wasn't her weight. That was how much weight she needed to lose. And nothing was happening. So she came to us. She was diagnosed Hashimoto's 15 years before on, guess what? T4 only. Her reverse T3 was a 22, and no one was testing that beforehand. Her free T3 was like a 2.3. So we left her on that GLP. We said, okay, we're not going to change anything yet. And I believe she was carnivore too, because she was getting desperate at this point. Nothing was working. And I said, we're going to focus on your thyroid. We're going to go over here and focus on your hormones too, because we wanted to get her hormones balanced, thyroid balance. Then all of a sudden, we're seeing her A1C starting to come down. And then we're starting to see her weight starting to come down. And it's like the GLP was allowed to work because we actually fixed the thyroid. We took the brakes off of her body. It's like she was driving a car with the brake on the whole time. Nothing was moving. So that's how impactful the thyroid is on our metabolism, on our glucose regulation, our insulin regulation, because not even these powerful, almighty GLPs, not even that worked for her.
Well, and in fact, I would argue that she probably didn't even need the GLP-1, because once people need to realize, and we talk about this relatively frequently, although maybe not in the last year, but your body will literally not release fat if insulin levels are high. So if you've got an HbA1c of 11 and your liver is dysfunctional because your thyroid is sending the wrong messages, you will not lose weight. It is literally impossible for you to lose weight. So if you fix the thyroid problem, which fixes the liver problem, which fixes the insulin problem, well, then the calorie deficit you're probably in, or the positive diet effects of the carnivore diet you're on, weight is literally going to fall off you. You will not be able to, there's people out there who, we always are jealous of these people who they can eat anything and they're thin. Well, it probably starts with the thyroid. It definitely means that they have naturally low insulin levels. I mean, if they're eating that much food and their weight is coming off them and they're not running 10 miles a day, then they've got the benefit of a very functional, as you said, T4 to T3, and not a lot of, bouncers out there keeping people from the nightclub.
Yep, exactly.
I think this case goes to show that we can't have this one-size-fits-all approach, even to weight loss, right? That these GLP-1, GIP, whatever it is, sema, tirzepatide, reta, whatever you're utilizing or you're aware of, that they only work when the circumstances enable them to work. And if you fix the circumstances, you probably don't even need the medication when the circumstances are effectively organized and working well. So the efficiency of the system is in the simplicity of the system. And if we think, oh, you're overweight, let's make sure that we're plugging away with this medication and we're upping the dose to like a 12.5 milligrams per deciliter. That's an insane amount of tirzepatide that some people are on. And if it's not working or you're not having an effect at a low dose, let's look at the other areas. Let's look at the thyroid. Let's look at the liver. Let's look at and address with optimal function, functional medicine, the idea of creating this holistic optimization. So I think that is underscored in the story that you've shared there.
Absolutely.
So let's go back one step, because I just want to make certain that as we're cheering on root cause medicine, let's get back to the root cause. There's Hashimoto's, and you said that's a lot of people. What drives Hashimoto's? I mean, it's arguably an autoimmune disease, so it's you got antibodies against your own thyroid. But what is it that is driving that autoimmune response? You talked about Epstein-Barr virus. There could be cross immunogenicity, but what is it that is driving that failure of H4 to H3 conversion peripherally, even outside the thyroid?
So when we look at, I always love to go back to that three-legged stool analogy. I believe that Alessio Fasano was the first one to present this analogy of the three-legged stool with autoimmunity. Basically, you have one leg of the stool is your genetic predisposition. So maybe your mom, your grandma, your aunt, this is where we take the family history and we go, oh, look, grandma had lupus and your mom has rheumatoid arthritis and your sister has Hashimoto's. Okay, there's a strong autoimmune component in your genetics. So we have that. Then the other leg of the stool, kind of going back to what you said, Dr. Beebe, is who doesn't have a leaky gut these days? Nobody has gut problems, right? So leaky gut, that's a big one. And then the trigger. So that third leg is the trigger. So what are the triggers? Well, going back to what we said about living in this toxic soup environment, all of the different chemicals, the pesticides, the toxins that we're exposed to every day, that's a stressor on the body. And, sometimes when we talk about like a stress bucket, like we all have this bucket and sometimes it overflows. And when it overflows, that's where we're starting to have issues. Like we can deal with this much stress, but not this much. So even, we always think of stress as the mental. I got money stress, I got family stress, kid stress, husband stress. But what about the toxic stress too, that creates a burden on your body and starts filling up that bucket? So toxins, any kind of stressor. And then the big ones of hormonal change, hormonal roller coasters. So I mentioned pregnancy earlier. Another time that is a huge time for women to be diagnosed with a thyroid condition is perimenopause and menopause. Because in perimenopause, menopause, something occurs that I talk about in the book. We have a full chapter on thyropause. And my definition of thyropause is when the thyroid gland craps the bed after the age of 40 due to those fluctuating hormones. Basically, as your progesterone starts to decline, followed by your testosterone, then your estrogen's on a wild up and down roller coaster ride. That's a huge stressor on the body that can turn that switch, that Hashimoto's switch, the autoimmune switch from the off position, which it could have been in that off position for decades. You got the genetic predisposition. Yeah, you got the leaky gut, but you're dealing with it. And here comes the stressor. Bam. Now it flips on. So this is where women will say, it was after my second kid that my body went to hell in a handbasket. I never got it back. I don't know what happened. Everything. I just started losing my hair and gaining weight and I could never lose it again. And I'm constipated. I'm depressed. Or it could be in a woman's 40s and 50s as she's going through perimenopause and menopause transition. So we always have to look at what was that trigger that turned that switch from the off position to the on position. And it could be so many different things. Now, again, that kind of goes back to when people ask me, well, what was the root cause of my thyroid problem? I'm like, I don't know, you got pregnant. Like, you can't undo that, whatever. And to this day, you mentioned EBV. I have not found a single soul that doesn't have Epstein-Barr virus. Like I got a frame ready. like MVP, I'm going to put it right here of the person's picture. Whoever doesn't have Epstein-Barr virus, let me know, because I'm pretty sure we have all been exposed to mono at some point in our life, right? It just is. So, I mean, it's almost like that's just the EBV is just the foundation. That's just setting us up. And then what's going to actually flip that switch?
Yeah, there's a whole bunch of viruses that are like that. I mean, I think at one point I looked into, the cold sore virus, the herpes 1 virus. I mean, it's like 92% of the population
Mhm.
has had that. Some people have it badly, some people don't, but it's there. And as you pointed out, every stress, whether it be a toxin, whether it be a pathogen, whether it be emotional stress, all of these stresses activate the immune system to the exact same extent. So it's really about the immune system and how the immune system regulates the thyroid, and which leads me, all roads go back to the autonomic nervous system. And Navaz is already smiling because he knows where this is going. But I'm going to take a little twist. I'm going to take a little turn
do
here,
it.
which there's some social media people out there who are promoting nicotine. Now, I don't think anybody on this podcast is actually actively promoting people smoking, but we all know that people who are super thin, it's the I don't know, the caricature or stereotype of the person who's smoking to stay thin. And we know people who stop smoking and they gain weight. Well, we know that nicotine regulates the immune system. We know that nicotine is a very potent anti-inflammatory. Is there a possibility that when you are coming off nicotine use, your immune system resets at a higher level and it triggers some level of thyroid dysfunction? It'd be very interesting. And I don't know if the research is out there, but as we're talking, I'm thinking to myself, has anybody looked at the difference in thyroid function between a person who's actively using nicotine and a person who's withdrawn from nicotine? Because
That's interesting.
I would imagine that there's an immune component, and because we all know people who quit smoking for their health, and then in the year or two after they quit smoking, they came down with some autoimmune disease, or they came across with some inflammatory problem that they didn't understand where it came from, and they think it's because I smoked for so many years. No, it's actually because you quit. It's because you came off. You got to do it the right way. You got to make certain that you're controlling that immune regulating function that you were supplementing with nicotine and now removed. It would just be really interesting to see that connection because we talk about vagus nerve stimulation as being a way to reduce that inflammatory burden through exactly the same channel. It's the nicotinic acetylcholine receptor. Be interesting to see whether or not you could do that. And vagus nerve stimulation is associated with weight loss. And I wonder whether or not vagus nerve stimulation is augmenting thyroid function.
Ooh, that is so good. And then the question would be, when they came off of, let's say, cigarettes, did they move to the nicotine patch as a gap? Because a lot of us are, which I actually have to order more, on a nicotine patch, not because I ever smoked, I never did, but because I was diagnosed with cancer last year. And all of my research showed hey, just like a little low dose of nicotine can exactly what you said, help the immune system, decrease inflammation. It's like, why not? So did those people move to a patch, or did they just go cold turkey? And that's when they started having
It's the
issues.
cold turkey ones who have the worst problem with it.
Yeah.
The ones who step down through the patch or the gum or some other exogenous way of getting it into their system, they do better. They do better. So just, a little caution out there. If you're smoking, by all means, quit smoking.
Right.
But because there's 600 other chemicals in that cigarette that are torching your body, literally torching it. No pun intended. But what you want to do is make certain that you don't deregulate your nervous system and your autonomic nervous system as a result, because your immune system is going to respond to that badly.
Yes, exactly.
It really does come back to this entire concept of immunometabolism that is being championed by Dr. Jeffrey Bland, the father of functional medicine, funny enough. So immunometabolism, the immune system and how it's metabolizing and its mitochondrial function, the mitochondrial function of the immune cells, and how that's regulating overall function in the body. And the immune system is linked to the nervous system, as all of our listeners know, through the autonomic nervous system and the vagus nerve in particular. And this plays that massive role. And so nicotine will play a really important role in here, obviously, of augmenting the alpha-7 nicotinic acetylcholine receptor. But what is the effect that it's having on the thyroid in there? That would be a really
and on
unique thing.
insulin receptors. And on
Insulin receptors for
receptors,
sure,
one-
yeah.
Yeah.
One of
Yeah.
the things that I discovered this, and I've written about it. I didn't personally discover it, but I read about it and said this needs to get out there in the literature, is that when you are inflamed, one of the very first things that happens is the individual cells, muscle cells, fat cells, et cetera, that's very stressful to them. And one of the very first things they want to do is insulate themselves from that inflammatory signaling. So they release something called suppressors of cytokine signaling, SOX proteins, not SOX, SOCS. And SOX protein 1 and SOX protein 3, which are two of the really big ones, one of the first things it does is it dismantles the insulin receptor substrate. So the intracellular portion of the insulin receptor gets degraded. So your cells become insulin resistant
Right.
because of inflammation.
Yeah.
Right.
So the best way that you can reduce your resistance to losing weight, if you want to lose weight, one of the very first things you need to do is lower your inflammation levels, because that will make your cells more insulin sensitive. And vagus nerve stimulation makes patients more insulin sensitive. They can become glucose normalized without medication, even though they haven't dropped a pound of weight. So it's
See, I'm going to love learning this from you guys when you come on the podcast, because now my brain's going. I'm like, okay, so could vagal nerve stimulation essentially help with T4 to T3 conversion and lower reverse T3 because of that direct mechanism?
we have to study that.
Yeah.
I think that would be a fantastic study to work on, and it would be simple to do. It really would be. Find people who are overweight, having a difficult time. T4 is not, just supplementing with T4 is not working. What's their inflammation level? Can we restore that T4 to T3 function with vagus nerve stimulation? Because it's also going to suppress the autoimmune disease.
Yes.
That's, it's been approved now for rheumatoid arthritis. We know that it works there. So it'd be really fantastic to study that and to see whether or not, I think that's a paper worthy of, the Lancet or something like Nature or Science. So we should look into that.
Yeah, we'll put our brains together. We'll do something. Yeah.
Yeah.
So your upcoming book is called The Thyroid Fix. And we've talked a lot about what needs to happen for the thyroid to function well and to produce T3 in good quantities and not have a bunch of TPO and TGB antibodies out there. What are some basic first steps, foundational first steps for people that either have been diagnosed with some sort of thyroid condition or are uncertain whether they have a thyroid type issue? Let's talk about some of the testing that they should do. You've already kind of outlined the specific tests. And what are the first steps they should take at home to begin creating an environment that is built to support thyroid and holistic overall health?
Yes, absolutely. So really, this book was written for those exact two sets of people, because I see them both. I see the people that they know they have a thyroid problem. We've been talking a lot about that today. They're on T4 only, standard of care, and that's that. But their symptoms are still raging and their quality of life has not improved. And then we have the other subset of people, basically where I was before the diagnosis. They have all of the symptoms, but they're being told like nothing to see here. There's nothing wrong. And so they're just really confused and really searching for answers. And just like you said, JP, you know your body, or maybe Dr. N, you said this, like, you know your body. And I love that. I was like amening, like, because I say that all the time. A person knows their body better than anyone else. Like, you know what's going on and when something is off. So it really is for those two groups of people. We start with symptoms. So in the book, I have a full symptom questionnaire. We're going through exactly all the different symptoms related to hypothyroidism. Yes, of course, there's the weight, there's the brain fog, there's the hair loss, there's the fatigue, but there's some other wild and wacky ones that a lot of people don't realize, like frozen shoulder or migraines that are related to hypothyroidism. So we really kind of break down all the symptoms so you can get an accurate picture of really exactly what you're dealing with and better understand why your body is reacting or responding the way it is. Then, of course, we go over here to the testing and we get all of those tests. And then I actually help the reader decipher their own labs. I have taught people for years now how to read their own labs. So I am literally taking them through, like, here's what we are looking for from an optimal range. No, we don't care what that standard lab value range says. I know. Your doctor said your labs are normal. We're not going to listen to that. Normal is a setting on the dryer. It shouldn't be used to describe your labs. We're going to look at it from an optimal standpoint. And then I built this, like, and Dr. Ann, you might be too young for this, but JP, you look like my age. Remember the Choose Your Own Adventure books?
Oh, yeah,
Back
sure.
in the day, remember? Okay. So I built this
I
like
may
that.
be
So
young, but I do know exactly what you're talking about.
okay, well, they were really fun. They were really fun. So I take readers through, like, okay, so you have a reverse T3 of it's falling in a 16. Okay, so you're a 16. So now we're going to go over here. And then I am on thyroid medication, let's say 50 micrograms of T4. Okay, then you're going to go here, which means that we're going to reduce your thyroid medication, your T4, and we're going to add in some T3. Oh, wait, maybe you're on NDT medication. Yeah, that's still 80% T4. So we're going to pull that back just by like 15 milligrams. And we're just going to add a little bit of T3 in there. And then we're going to move over here to this category. And we're going to start looking at nutrient depletion, because nothing is going to work if you don't have the foundation. So let's get in the nutrients. I have a list of supplements called the no-duh supplements, also dating myself back to the 80s. Like, of course, you're going to take these every day. So that's your vitamin D and your magnesium and your selenium and your zinc and your B vitamins. And yes, iodine. I know, controversial. I can certainly answer any questions on that. But yes, iodine, very important. So we're going to build that foundation. And then we're going to kind of expand out from there. And we're going to look at what you are eating. Now, I'm not dogmatic in my nutrition. It's, we got to figure out what's going to work for you. And I joke, I'm like, the Thyroid Fix is not a diet book. It's not a recipe book. It's not a workout plan book. It's not a sprinkle adrenal fairy dust on your thyroid and do a rain dance book, right? It is. I'm getting real. We're talking about labs. We're talking about medications. And then, yes, we are talking about biohacks like GLPs and different things that you could do or not do that could hurt or help your thyroid. Certain peptides like thymosin alpha. Yes, of course, that's a pro. So I really go into all of that. So to answer your question of what they can do at home, nowadays we can do testing at home, but appropriately, I would love for you to go to an actual LabCorp request and get the full blood draw. And then let's look at things together. You can order your own labs. That's easy to do. And then we have to build that foundation. But the medication piece is going to take a willing partner to collaborate with you in that journey to get you better. So the other part of the book is that I do talk about exactly how to talk to your doctor. Not only how to talk to your doctor, but first how to find one. And the questions to ask before you hand over a copay or before you pay that functional medicine practitioner. Because there's a lot of functional practitioners out there that are jacks of all trades and masters of none. And if you're not a master in the thyroid and hormones, and your specialty is mold, well, then you might want to stay in that lane for mold. And you have to, as a thyroid patient, have to find somebody that specializes in thyroid and hormones. But I do give you a fighting chance to work in the insurance-based system if you can, and tell you exactly how to approach your doctor.
I love this. I think the book is comprehensive as a great tool for anybody who's on this journey of trying to sort out what's going on with their thyroid. I've loved this conversation. I think it's been enlightening. There's a lot of synergies you're going to see when you have me on the podcast real soon. We're going to talk all about stress and the autonomic nervous system and vagus nerve work and all of that. But I want to kind of lean into asking JP if he has any final questions and how do we make this work long term? Yeah,
our guest here a chance to put a plug in again for anything else that's in the book that you think our listeners would be interested in. I know we've spent an hour at this point or more talking about the thyroid and all of the important things that it does, or some of the important things it does, not even all. What else are people going to see in the book that they should go out and pick a copy of?
Yeah, well, exactly. Go get the copy, and then you'll see what else is in the book. Yeah. So we do. I know we talked off air a little bit, and I don't know if you want to get into this just as like a little GLP-1 talk, but I do talk about that because that actually has its own section in the book because a lot of people, we have to face it, a lot of people are using them, and a lot of people are using them incorrectly. Some are using them correctly, maybe in a microdose form to lower inflammation, something like that. But I really wanted to clarify that because I think in the history of as much as I've been alive, I have never seen a pharmaceutical be such a Jekyll and Hyde pharmaceutical. It's like it's okay, it could be good if used appropriately, but it's got a lot of bad. And it's like these two extremes where how did we get so far where we're having celebrities post on Instagram about their multi-level marketing coupon for a GLP. Like, where are we right now?
Yeah.
So,
The only drug that probably would have had the same, had it come out at the same time, is Viagra. I mean,
right.
the only one that could have had, and it's interesting. I think you're making a really interesting point about the fact that there are some serious negative drawbacks to these drugs. I mean, GLP-1s are not miracles. They are very powerful, but they are not miracles, and they can cause real damage and cause you real problems, permanent problems. And so you need to be careful with them and make certain that you're using them properly. And yet you can get them anywhere. I mean, it's just they're being handed out like Skittles.
Yep.
And it doesn't work for everybody, and it's not appropriate for everybody, and it does damage to some people. We need to get a handle on this, but the fact that it is associated with weight loss is the problem. The fact that it's associated with weight loss, just the same way erectile difficulty, if it's about weight loss and sex, you're going to end up with irrational behavior around it.
Oh, yeah. If GLP-1s just help your gout, it wouldn't be a multi-trillion-dollar company right now.
Exactly.
Yeah.
Exactly.
Yeah.
We got something with hair loss is gonna end up right, Dr. N. It's going to be the same way.
You and I both need it so badly.
Yeah. So no, you guys did a great job of covering so much, and then we'll just leave the rest as a teaser for people to get the book.
I love it.
Okay.
Well, this was an absolutely wonderful conversation, Dr. Amie Hornamen. I love the conversation. I'm really excited to share the book with clients and with people that are in need of support. I have a couple family members that could definitely use this, and I will be sharing it with them. And I think that's exactly the point here. If you're listening and you got to this point in the podcast, share this book with 1, 2, 3 people who you think could utilize this information to upgrade their health. Ultimately, we just want to see a healthier world. We want people empowered to take back control of their health. And that's the ultimate goal of everything that we do on the podcast, all the guests that we have. Ultimately, we want people to be healthier. So share this information, even just the episode, with a couple people who you think could utilize this information. Dr. Amie, when is the book out? What's the official date?
Officially out May 12th, but you can pre-order now at any point in time, and it will ship to you on that date. You can go to thyroidfixbook.com, and on there, you'll actually see a bunch of bonuses that we're going to have available all the way up until May 16th. You can get a coupon code for 20% off the Fix or Supplement line. We have hidden podcast episodes that we're just giving the people that buy the book. And we're doing an all-day live launch party on May 16th. So if you do purchase the book, you get a free Zoom ticket, meaning you're in the VIP room with me to be able to ask any question. You're going to be able to ask questions of the experts on that I'm bringing on. We're going to do live lab reads, so you'll get a much better understanding of your labs. It's going to be a great time. So buy the book now. That way you can get in on the party.
That sounds like a phenomenal value for anybody who's looking to really uncover what's going on and, get to ask you one-on-one real questions. I think that's going to be amazing for everybody. So highly recommend getting the book and getting on the live Zoom and making sure that you are understanding how to ultimately fix your thyroid. Thank you guys so much for a wonderful conversation. And thank you all for listening. We'll catch you all on the next one.